ago, a psychiatric patient at the West Palm Beach VA was killed, strangled by his roommate. The big question then, why were two acutely psychotic patients sharing a room?
Yeah, now a year later, another attack, this time a nurse assaulted by a Baker Act patient at a different hospital.
Both facilities were found to be following policy. So what does safety really look like in hospitals?
CBS 12's Katie Benty joins us in the newsroom now with what experts are saying. Katie.
Two cases, two hospitals, both cleared of safety violations. But when a patient is killed and a nurse is left in critical condition, what's missing? I asked a psychiatrist who oversees a dedicated mental health unit, how do hospitals screen for violence? Hospitals are meant to heal, but in some cases, safety isn't guaranteed. What is the protocol when a potential psychiatric patient comes in?
One of the most important things that we do is admission screening. Is this someone that has a history of violence? Are they in a psychotic episode where they're acting out aggressively?
At Memorial Regional in Broward County, Dr. Daniel Bober oversees a secure psychiatric unit with controlled access, cameras, and even reinforced furniture. But not every hospital has that level of security. Last year, Christopher Schweikart, a former military pilot, confessed to killing his roommate inside the VA Medical Center in West Palm Beach. He was found not guilty by reason of insanity. An internal review found the hospital followed protocol. But why were two acutely psychotic patients roomed together at all?
If we were to give everyone a private room, then we would have half the number of beds available to treat other psychiatric patients. So what we try to do is, again, pre-screen the patients.
Another case, similar questions. Last month, police say Stephen Scantlebury, a Baker Act patient at Palms West, attacked a nurse while waiting for transfer to a registered receiving facility. A state inspection found no safety violations. But did the hospital have the resources to handle him? At Memorial, Bober says they try to use a buddy system, sending a second nurse, doctor, or even a security officer for high-risk patients. If needed, they can add restraints or seclusions as another layer of control.
We have what we call gray alert protocols. Everyone comes, the security staff comes, nursing comes, the behavioral health techs come.
But for a hospital that isn't designed to handle psychiatric crises long-term, like Palms West, the resources may look different.
There is just no way to be 100% safe. We focus on risk mitigation, doing things that we can do to reduce the risk, but not completely eliminate it.
The VA has not confirmed whether its policies have changed since Schweikart's case, and we're still waiting for answers. In the newsroom, I'm Katie Benty, CBS 12 News.